So, hello everyone. Thank you for joining today's session. So, today we'll be speaking about the specialty, which is psychiatry. A very warm welcome to you, doctor.
Thank you.
Okay, so we have Dr. Pallavi today, who will be speaking about this specialty. To introduce Doctor has 8 years of experience in the field of psychiatry. Doctor has done her MBBS from Patna Medical College and MD in psychiatry from AIIMS, New Delhi. Along with that, doctor has a 1 year of working experience. Doctor is currently working as a psychiatry specialist at IIT Delhi. And from past 4 months, she's associated with Shama Hospital as a consultant psychiatrist. So a very warm welcome to you, doctor, once again.
Thank you, Kanika.
So, doctor, to start with, could you please give an insight about what is specialty all about? Like, what is psychiatry specialty all about?
Yeah. So first of all, thank you, Kanika, for bringing me to this platform. And so usually in our undergraduate or as MBBS students, what we understand about psychiatry is that it's basically limited to just answering 1 or 2 questions in the professional exam and having a 15 days of internship posting, which is not adequate enough to get an insight into what psychiatry is about. And to be very frank, most of us don't attend those postings. So what psychiatry is about? Psychiatry is a branch, it is a clinical branch which deals with disorders of emotion, behavior, cognition, thought, perception. So it is basically a branch which deals with psychiatric illnesses, their treatment, management, and prevention. So this is what psychiatry is about. And it is much more than what social media talks about. So in psychiatry, you will come across a wide variety of disorders, ranging from mood disorder, which includes depression and bipolar affective disorder. You have psychotic disorders like schizophrenia. You have OCD, anxiety disorder, personality disorder, eating disorder, personality and addiction related disorders. So it is a wide range of topics that you cover in psychiatry. Now, I would just like to add that what exactly one should expect in their MD psychiatry curriculum. So what is the curriculum about? Now, in MD psychiatry, during your 3 years of posting, you will be posted in OPDs. You have ward, so you will be posted in the IPD or the ward postings will be there. Some colleges don't have wards, so you might not get a ward posting over there. You have emergency postings like any other clinical branch. So, for example, in my junior residency, I had somewhere around 3 to 5 emergency duties a month. You would also be posted in various others. You will have a lot of peripheral postings. For example, you will be posted in trauma psychiatry, neuropsychiatry, consultation liaison psychiatry. The basic idea behind all this is that these areas deal with the psychiatric manifestations or psychiatric sequelae of other medical and surgical disorders. And you have postings in community psychiatry, neuromodulation, where you get to know about the newer techniques, in psychotherapy, where you get to know about counseling, therapy, and conducting psychological tests. And you are also posted in specialty clinics like child adolescent psychiatry, addiction psychiatry, and at some places in geriatric psychiatry. So this is how the psychiatry curriculum goes.
Okay. So, doctor, in this webinar, we are mainly concentrating to help the doctors, those who have just completed their MBBS. So, like our target audience is them, but along with that, there will be other students also, those who would have completed their post graduation. But still, there is like sometimes doctors might feel like, no, we want to know about the other specialties also. To address them also, who should and who should not take this specialty?
Yeah. So this is a personal opinion as well as what I have come across when I speak to my seniors as well. So until and unless you have an aversion for psychiatry, that you don't like the branch at all, there is as such nothing that should stop you from taking up the branch. So there is a lot of myth and stigma that revolves around psychiatry. So unfortunately, it is a less opted branch. For example, when a person who has just done her MBBS or his MBBS and discusses this with his senior that I want to take up psychiatry, and the first reaction that comes, Arey, why do you want to waste your clinical skills? Why do you want to go in psychiatry? You will end up becoming crazy. You will become depressed. Psychiatry is all about violent patients. You might get hit while you are treating these patients. So these myths shouldn't stop you from taking up the branch. These are just myths. So when it comes to psychiatry, just like any other clinical branch, when it comes to the clinical underpinnings, when it comes to treatment, management, it is just like any other medical branch. Now, people have their own reasons for taking up psychiatry. Some feel that, it is a very interesting branch because you are learning about human behavior, emotions. So some people take it out of interest. Some people feel that it is an underserved branch and they need to work a lot in this area. So it is a challenging role to take up. There's a lot of research opportunities as well because there's a lot being talked about the biological underpinnings when it comes to etiology, and there is a lot of research going on in the area of newer drugs, newer techniques. So there are good research opportunities, so people take it. Also, some people have seen their near and dear ones struggling from mental health issues. They know how like it is so taxing for the family, for their friends. So that could also be an area which prompts them to take up psychiatry. And there are some other practical reasons as well, which we'll discuss when we discuss about the career opportunities. But for me, like I took up psychiatry because psychiatry follows this biopsychosocial model. So you're not just treating patients by giving medications; you're addressing a lot of psychosocial issues. So it becomes a very holistic approach. So that was very interesting about psychiatry. I was not liking the branch which I was into earlier, and the working environment. So all those kind of factors led me to take up psychiatry. So the basic idea is that the stigma should not stop you from taking it until unless you have a disliking for the subject. There's nothing that actually stops you from taking up the branch.
Okay, Doctor, what are the career opportunities and like a job opportunities in this field? And the most important is like how much a doctor can expect that they will earn if they choose psychiatry as their specialty.
Yeah. So now the career opportunities would depend upon what you want to do ahead after doing your MD. So suppose you want to work in a government sector, you want to be associated with a teaching job, then you need to go for senior residency, because for being eligible for the post of assistant professor in any college, you need to have 3 years of senior residency experience. That is primarily for the central institutes as well as for many of the colleges in Delhi, which require a 3 year residency. In some of the state colleges, 1 year residency is also enough. So you can go for government medical colleges, you can go for private medical colleges. And so one is the experience, you need to go for senior residency. And when it comes to salary package for the in this field, so the salary package when you start up the career as a AP, it would be somewhere around 1.2 to 1.5 lakhs per month. And as you go ahead, when till the time you become a professor, it would be somewhere around 2 lakhs or slightly more than that. And the revision also keeps on happening, so it might increase. So this is the usual salary package that you can expect. The good point about being associated with a teaching job is that you can see patients, you can go for research, you can be associated with teaching. So in that ways, it gives a lot of opportunities. The issue, and you get a fixed salary as well. The problem is that there are not many seats because there is a limitation in the number of seats that are available. So in that ways, not everyone who ends up doing a senior residency might get a job in a government medical college or a private medical college. So this is one aspect of the career. Then if you want to go for private practice. Now in private practice, there are again 3 options. You can be associated with a corporate hospital. The issue here is that since most of the corporate hospitals do not have inpatient for psychiatry, they might not be willing to give you a good amount of salary because as such, you're not contributing to the inpatient care. But they do have OPDs and they do have consultation license, especially places which have a lot of transplant patients. They need psychiatric clearance. So they would require a psychiatrist. The salary package would depend on which place you are working. So for example, in Delhi, it would be somewhere around 1.3 to 1.8, ranging upon your experience. It might be slightly more if you move to the periphery. For example, I know students, I know some of my colleagues who are getting even up to 3 lakh in corporate hospitals, uh, not in Delhi, but at other places in 2-tier or 3-tier cities. Then you can go for chamber practice, you can go for your own clinic. Now in chamber practice, the pros and cons would be that it's not your own setup. They're basically a polyclinic or a hospital that gives you place to run your OPD, but they take a share of it. So you either pay the rent or you pay a share of the earnings that you gain. And when you set up a clinic, your own clinic, the good thing about psychiatry is that you don't need much investment if you're planning to put up a setup. All you need is stationery or furniture and the basic essentials that are required. Now, private practice is bound to flourish. So if people feel that, psychiatry may 2-tier cities and 3-tier cities don't do pretty well, you need to be in metropolitan. So ultimately it will flourish depending upon the time and amount of resources you are willing to invest into it. It is bound to flourish. The other options, career options, is that you can be associated with rehabilitation centers. You can be associated with NGOs, old age homes. Now there is a lot of talk about school mental health. So you can be associated with schools or universities, corporate sector. They also need a specialist as a psychiatrist. So those options are there. If you want to go for super specialization, you can even go for that. So there are DM degrees available in primarily 3 areas: addiction psychiatry, child and adolescent psychiatry, and geriatric psychiatry. So NIMHANS in Bangalore offers DM degrees in all of these, and AIMS Delhi offers in addiction psychiatry, PGI Chandigarh offers. You can also go for 3-year fellowship. So you can also go for PDF or fellowship. That is a 1-year or 2-year fellowship, like CMC Vellore, JIPMER, NIMHANS. They offer fellowship courses as well. Now the point here is that in psychiatry, the good thing is that you can be generic and still you can flourish. You can be specialized and still you can flourish. So it is up to you. Unlike other branches of medicine where a DM degree becomes very essential, especially in medicine, general medicine. In that sense, in psychiatry, you have the privilege of doing either way, whichever you want. And then there are options of going abroad as well. So you can go to UK, Australia, New Zealand, and you can go for fellowships abroad. So all these options are available as far as your career opportunities are concerned. And one may feel that there is to some extent, since you're not too much into invasive procedures, or so there could be some capping as far as the amount that you can earn. But then I would like to add that there are psychiatrists who are earning even up to, 7-8 lakh per month, even much more than that. So if you have your own setup, if you have inpatients, so it all depends upon how much risk you are willing to take, how much resources you're willing to invest, how much time you're willing to invest. It would depend on that.
Doctor, would you like to answer, like in specialities, there, if doctor is going to take any of the specialty, there is MD in psychiatry, or is there DNB in psychiatry also, something like that?
Yeah, so you have MD in psychiatry, you have DNB in psychiatry. Some people also do a diploma in psychiatry, DPM. Now, MD and DNB is equivalent. So as such, there is no differentiation between that. Diploma is a 2-year course. So the amount of clinical experience that you get when you're doing your MD degree, the 3-year course, in that sense, it is slightly restricted. But on the contrary, some people feel that if you want to go for private practice, you can start up more early, even after 2 years of completing DPM. After DPM, you can also go for secondary DNB in psychiatry. So that option is also open if you want to be eligible for a teaching job. So for going into a teaching job, just a diploma would not be sufficient enough for becoming eligible for that.
Okay. So doctor, could you give an insight, like how, if any doctor chooses specialty as their psychiatric, which colleges they should choose, and what are the things they should keep in their mind before choosing any college?
Yeah. So see, as I told that in psychiatry, there are not a lot of tests which help you making a diagnosis. There are not many tests which or biological markers or that help you prognosticate a case or guide the treatment. So the entire principle is based on the clinical expertise. So it is all clinical evaluation, taking more history, obtaining information from more collateral sources. So you have to invest a lot of time with the patients. So choose a hospital which has a good patient footfall. That will be very important. Also, if you choose a college, you should know about the academic and the research opportunities that the college offers, so that you have all options open for you later after completing your MD, and you get an exposure of all of that. This information can be received from, you can take this information from the university websites. You can get the information, first-hand information from those who have done the residency from that particular college. So in a lot of colleges which do not have inpatient, the entire focus is on patient management, and academics and research might not be given that much priority. So if you have an option, choose a college which offers you all of these. Also, if the college offers you super specialty postings, because not all of us will turn up doing DM or a fellowship. So you should have some exposure about what child psychiatry is, how to deal with these patients, or geriatric or addiction psychiatry. So if that is an option, you should go for that. Then, as I said, that there are a lot of newer techniques that have come up, like RTMS, TDCS, ECT. So later, if you want to set up your own clinic and you want to add these to your clinic, or if you want to kind of work in a corporate sector who wants to bring up RTMS, so this will be an added advantage if you have an exposure to these things in your MD course. Other is that basically a posting in all other peripheral areas which I mentioned. Consultation liaison is something which you would want to have an experience about if you want to work in a corporate sector. So ideally, patient footfall, academics, research, and newer techniques, all these kind of things one should keep in mind. Super specialty postings. So if a college offers that, you should go for that.
Okay. So, doctor, last question, like, how is patient handling in this field? It's like complicated. Do doctors have to be very patient while handling the patients, or how it's going to be?
Yeah. First of all, there's this a myth that you have to be too much into conversation if you want to go for psychiatry. The history taking is a very important aspect if you talk about any clinical branch. So history taking becomes very important. But yes, if you're someone who is just not willing to give that much effort, if you want to, that is something that stops you from interacting so much, is a difficult task for you, then it might not be a good option. But otherwise, it's not that complicated how it appears, that you have to. And with time, as you gain expertise, the amount of time that you invest with the patient also decreases, because now you have gained that clinical expertise, so you can more quickly make a diagnosis. You know what specific questions to ask for. The more time investment goes in the MD days, rather than as you go ahead, the emergency duties decrease. You are not supposed to be on call most of the times. Then you have the option of working even part-time, full-time. So in that sense, the profession itself offers a lot of flexible uh, opportunities. So uh, there is no contraindication for taking up psychiatry. And as far as violent patients are concerned, they are very less in number. There's a lot of new treatment, good treatment, better response rate. So all that adds up. So nothing, you should just, the idea is that you should not have an aversion for it. That's it.
Okay. Thank you so much, doctor, for answering all the questions. Would you like to give some last minute message to the doctors once they see the session?
Yeah, so the message from my side is that the idea is not that you should, psychiatry is a very upcoming branch. Everyone keeps on telling it's an upcoming branch. No, it's already there. It has been there, and after COVID, the demand has increased. So not everyone should turn up becoming a psychiatrist. But yes, the stigma and the myth around it should not stop you from taking it up as a career option. You have the liberty to work in a generic manner. You have to work liberty to work as a specialist. So the guiding principle should be your interest into the branch. And so, for example, I did not want to become a gynecologist. I was very clear about that. But it doesn't mean that I feel that, gynecologists don't do a good job, or I don't like that subject. So this idea applies to psychiatry as well. And when it comes to the underpinnings, clinical underpinnings, management, it is just like any other branch. So it is a good option to opt for. And you can definitely go ahead with it as a career option. And there's, the journey is very emotionally rewarding and satisfying because you holistically manage your patients. And on a personal front, I feel that it has made me more insightful and reflective. As a branch, it has helped me a lot. So you can go ahead with this branch. Also, if there are any other queries that the students were willing to ask, they can discuss it over email.
Yes, definitely, doctor. If there is any questions, we'll collect it and we'll mail it to you, doctor. Thank you so much, doctor, for your time. And thank you so much for answering all the questions once again. We'll end the session here.
Yeah, thank you, Ganesha.
Thank you.